So you may be asking yourself, well, what are your options? If you're having knee pain, back pain, neck pain, shoulder pain, or other joint pain, what are your options? Do nothing different. Anybody think that's a good idea? Yeah, you know, most people have come to the realization, look, you guys are here, and the occasional person comes to this because it's a free dinner, but for the most part, look at her point calling you out, look at that.
He has it back.
Okay. For the most part, people are here because they really would like to do something better for their health, and so great job being here. Doing nothing doesn't tend to be a good option. What about more drugs?
Still a bad option.
It's a terrible option because more drugs doesn't work. Does anybody know of anybody that started taking pain medication and with a real problem that ultimately didn't require higher and higher doses of pain medication? That's the problem with pain medication, is that we develop tolerance to it. It does nothing to heal the underlying problem. So with that being the case, the only option is more and more pain medication and ultimately more and more degenerative change in your body. What about surgery? Painful, expensive, often requires more surgeries. So these being the options, I want you to think about these options in the context that we originally talked about. Again, safety, effectiveness, affordability. Sometimes drugs, they seem affordable initially, but you know what? When you look at it over the long term, they ultimately typically end up in a significant loss of quality of life. And I know people that have been on hundreds of dollars of pain medication every month. So that's not so cost effective either. The cost of surgery, pain, no guarantee of result, 3 to 6 months of healing and rehab time, a high percentage of failure and complications, 50% or more will need additional surgery. The total average cost for an uncomplicated case is $55,000, much of it coming out of the deductible. So what's the cost? Lost time, lost function, and pain.
Again.
Yeah, exactly. Does anybody, okay, in a room with this many people in it, how many of you have a friend or a family member that has had a surgery that has gone badly? Yeah, I mean, I have never had, I've had smaller groups and larger groups, but without fail, there's a significant number of people that can relate on a very close level to somebody that's had a bad outcome. And so, you know, when we think about surgery as an option, that's the risk. You know, Medicare might cover a surgery, but they won't cover the loss of function that you may experience as a result of that surgery and the loss of quality of life that can go along with it as well. So surgery has risks. This is from Journal of Orthopedic Medicine. Risk of bleeding problems, blood clots caused by surgery, the risk of infections after surgery, the risk of death. 1 in 400 deaths in 30 days following complications. I have a close friend whose father had a knee surgery, got an infection in it. That infection, they went in multiple times and ultimately could not get rid of that infection, and eventually that infection went systemic and he passed away from it. So this is not an unreal risk, it's a very real risk. And of course, increased use of narcotics, non-steroidal anti-inflammatory drugs, and muscle relaxers. So again, safe, effective, cost. This tells us that there are some risks that go along with surgery. The fact that there's class action lawsuits against the hardware that goes in. And this one talks about painkillers and anti-inflammatories. They literally are dangerous. This is from the FDA. There's an epidemic of adverse drug reactions to non-steroidal anti-inflammatory drugs. Over 40,000 deaths each year are the result of severe bleeding caused by NSAIDs and opioids. This is a big problem. This is a safety issue with the drug option. So what about cortisone shots? Well, cortisone can cause osteoporosis, cataracts, hyperglycemia, immunosuppression, and sadly, the worst part about cortisone shots is the fact that even though they feel better initially, they ultimately result in joint erosion. they wreak havoc on the cartilage surfaces of
Don't work.
joints. And ultimately, there you have it. So, again, safe, effective, maybe briefly for some people, and these are costs. That's a reality. So, I like to think of it like this. Saying no to stem cells is like saying yes to more drugs, more steroid injections, more surgery, maybe multiple surgeries, and more recovery drugs. Again, consider it from the context of safety, effectiveness, and affordability. But the good news is that you do have choices now. You can think the same and do the same things and get the same results, or you can regenerate with stem cell therapy. So I say this kind of tongue-in-cheek. 3 reasons to get stem cell injections. Well, they only work if you get them. Let's not overstate the obvious, right?
Can't win if you don't play.
That's right. Your best chance of improvement is now. Health problems do tend to get worse over time. Many people here have experienced that personally. And ultimately, this is the one that really hits home the most. There's just nothing, not your car, not your house, not anything, that is really more important than your health. Every bit of your quality of life every day is based on your health.